The Pleurx drainage system is used by doctors and nurses in the hospital and by patients in the privacy of their own homes to drain fluid from the pleural space. In order to complete this task, you will need to have the proper supplies on hand. This video explains what supplies you'll need, how to obtain these supplies at St. Mary Mercy Hospital, and how those supplies are used with the Pleurx system. The Pleurx catheter will be inserted into the patient's pleural space while in interventional radiology. The catheter is a 15 French tube with fenestrated holes along its second half. These are small holes positioned along the catheter to allow for drainage of fluid from multiple places, not just the open end of the tubing. In the middle of the catheter is the dacron cuff. This is a small cuff of material that serves first to help anchor the catheter in place in the patient, and also can be used as a warning sign that the catheter has been displaced. The dacron cuff should be located beneath the patient's skin and should not be seen. If it is visible, the catheter has been pulled out, and placement should be confirmed before moving forward with drainage. Finally, on the end of the catheter is the one-way valve. When not in use, the valve should always be covered by a sterile cap. Removing the cap reveals a small port. In that port are 2 layers of rubber that create 2 one-way valves that seal the end of the catheter so that nothing can get in or out of the pleural space unless the appropriate adapter is inserted into the valves. The portion of the catheter that will remain outside of the patient's body spans from the one-way valve to just above the dacron cuff. The portion that should remain inside the patient is from the dacron cuff to the open end of the catheter. When it's time to perform a Pleurx drainage, you'll need to make sure you have the drainage kit on hand. Ordering from CSPD under Trays and Kits, you can choose Kit Cath Pleurx 1000 ml. This will order what is called the starter kit. It is a box containing 4 separate drainage kits. If the patient is going to be going home with a Pleurx drain, they should be leaving the hospital with a full starter kit. If you are only ordering a single drainage kit, from the Tray and Kits charges, choose Kit Drain Pleurx 1000 ml bottle. This will order a single drainage kit. Inside of that kit, you will find a package of sterile supplies. This packet contains everything needed to complete a Pleurx drainage. This includes a new sterile cap, 3 alcohol pads, a blue emergency clamp, a stack of gauze pads, and a foam pad with a slit in it. Sterile gloves are supplied in the Pleurx kit. However, if you would prefer, you can use the fitted sterile gloves available in the pod rooms. Also, if you would prefer ChloraPrep to alcohol, you can replace the alcohol swabs with 3 small ChloraPrep sponges. Also included is a large tegaderm that you will use when you replace the dressing. Every item in this kit should be used with every drainage, with the exception of the emergency blue clamp. This clamp should only be used in the event that the catheter is cut or breaks, allowing fluid, air, or bacteria to move into and out of the pleural space freely. If this occurs, secure the clamp over the catheter as close to the patient as you can and call a rapid response. This break could cause many complications, including pneumothorax. Finally, we have the drainage bottle. The bottle can hold a maximum of 1,000 milliliters. It is vacuum sealed so that when activated, the negative pressure will actively pull fluid from the pleural space. There are markings on the side of the bottle to allow for accurate measurement of the drainage fluid. The bottle is capped with a T-plunger. While in the package, the T-plunger is protected from accidentally being pressed into the bottle by a plastic clamp. After taking the bottle from the package, the clamp can be removed. On the bottle's tubing is a roller clamp. After removal from the package, the roller clamp should be closed. The roller clamp allows the nurse to control the amount of negative pressure being exerted on the pleural space at any given time. With the roller clamp closed, pressing the T-plunger into the bottle will activate the negative pressure. At the end of the tubing is the adapter that will fit into the one-way valve of the Pleurx catheter. Care must be taken to ensure that this adapter remains free from contamination, as it will be introduced into the Pleurx system. The final feature of the bottle is the base of the T-plunger. When drainage is complete, it can be removed and used to expand the opening of the bottle to aid in the disposal of the drained fluid. When you have all of these supplies and understand their use, you can begin drainage of the Pleurx system.